Welcome, everyone. Thank you for joining us today, our webinar with Dental and Vision for our retirees. We have plan representatives today from our vendors with us who will be happy to answer your questions through the Q&A comments in this webinar. And there's going to be a presentation that's pre-recorded that will allow the plan representatives to focus on answering the questions in that Q&A section while that presentation is going. And then at the end of the presentation, you'll be able to hear the plan reps answer those questions back out and continue answering any questions that come through. So with that, let's get started. I'll bring up our presentation. I'll take a few seconds. Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for Plan Year 2026. Open enrollment is a period each year when all members can enroll in benefits coverage and change their current benefits coverage for the upcoming calendar year. You can change from one plan to another, enroll or waive coverage, add remove dependents from coverage, enroll in flexible spending accounts. If you do nothing, your current year benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts each year to participate. Your new benefit choices are effective January 1st, 2026. Open enrollment starts at 8 a.m. on Wednesday, October 1st, 2025, and ends at 5 p.m. on Friday, October 25th, 2025. You may enroll online through SF MyHub, located at sfhss.org. How to enroll. Find the open enrollment tile to access the My Health benefits to make your new benefit elections. City and county employees can also access SF MyHub through the SF My portal. Paper applications must be postmarked by October 24th, 2025 to be accepted. You'll be on mute and off camera for the entire presentation. We encourage you to ask questions. We will be using the Q&A function in Microsoft Teams. Scroll through your screen to find the menu bar, either at the top or bottom of the screen, depending on whether you're using your computer or mobile device. Click on the Q&A icon in your menu bar. Click on Create Post to type your question. We will answer as many questions as time allows during the Q&A session. Please do not share personal medical information in the chat. Everyone can see it. We recommend a one-on-one consultation. If you have questions that do include personal and private medical information, please schedule a private one-on-one consultation with a health plan vendor. Our health plan vendors have open enrollment office hours. To schedule an appointment, visit sfhss.org/OE2026. If you have eligibility questions, please call SFHSS Member Services at 628-652-4700 or visit our offices at 1145 Market Street, the third floor, during our business hours listed on the screen for further assistance. And we want to remind everyone to get their annual flu shot and COVID booster to protect yourself and your loved ones this fall and winter. With that, our presentation will now begin.
Here's how your Delta dental plans will help you shine. Released in 2000, the first ever Surgeon General report on oral health emphasized the importance of oral health to overall wellness. The terms oral health and general health should not be interpreted as separate entities. Oral health is integral to general health. Oral health means more than healthy teeth, and you cannot be healthy without oral health. We now know that the mouth serves as a mirror, showing us information about other parts of our body, like systemic disease and cancer. This visual shows all the ways that our oral health can affect our overall health. Poor gum health and tooth loss can increase your risk for a variety of chronic conditions and health issues, including those shown here. Gum disease is associated with an increased risk of preterm birth, as well as low birth weight and other pregnancy complications. Oral health can even affect your mental health. Oral health issues such as untreated cavities and tooth loss may result in serious mental health issues, including depression, social anxiety, and low self-esteem. There are plan features that are here to assist with maintaining good oral health. On the DHMO plan, low to no cost copayments. On the PPO plan, diagnostic and preventive maximum waiver and SmileWay benefits that we will highlight in the presentation. Now let's take some time to go over your plan options. Let's go over the DeltaCare USA plan first. The DeltaCare USA plan offers many advantages, including most covered services at a no cost or low cost copayment to the member, no annual maximum, no deductible, no claim forms to fill out, predictable costs as your benefits guide shows all covered services and what your copayment is for those services. Getting started with DeltaCare USA is easy. Go online to look up DeltaCare USA providers. Then visit any DeltaCare USA general dentist that is accepting new patients. When your dentist files a qualifying claim, you will be added to their roster and they will become your assigned DeltaCare USA dentist for any future appointments. You must visit this dentist for future visits to receive benefits. You can change your general dentist by contacting Delta Dental by phone or through your online account. Provider changes made between the 1st and 15th of the month are effective immediately. Provider changes made on or after the 16th of the month are effective the 1st of the following month. When you visit the dentist, you don't need to bring an ID card to receive treatment. Just provide the dental office with your name, social security number or enrollee ID, and your date of birth. Your dentist will work directly with us to complete any necessary paperwork, so you don't need to worry about any claim forms. Just pay your copayment if you have one at the time of treatment. Read your plan booklet to learn more about covered procedures and copayment amounts. Specialty care is available with a referral from your primary care dentist. For out-of-area emergency care, if you need urgent care and are away from your primary care dentist, DeltaCare USA provides a limited allowance for care. A few details to keep in mind. You will be required to pay for treatment and request reimbursement. Refer to your plan booklet for specific coverage details and procedures. Let's take a quick look at some of the covered services and copayments. As you can see, there are no deductibles to meet and no annual maximum. We have highlighted some of the more common dental procedures and their copayments. Here is a look at the orthodontic coverage for children and adults, which includes all phases of ortho treatment, pre and post records, tooth extractions, and coverage for ortho progress in treatment. It also shows you the startup fee. Now let's take some time to get to know your Delta Dental PPO plan. Maximize your savings with a PPO dentist. Get the most value from the PPO plan by choosing a Delta Dental PPO dentist. You do have the flexibility to see any licensed dentist. You can visit any licensed dentist and receive coverage. You won't be charged more than your expected share. PPO network dentists agree to set fees. This means you won't be balance billed. You won't be charged more than your expected part of the bill. Here is a glance at your PPO benefits. You have no deductible when using a Delta PPO dentist. You have a $50 per person and $100 per family deductible each calendar year when using a Delta Premier and non-Delta Dental dentist. Annual maximum is $1,250 per person each calendar year, with diagnostic and preventive services waived towards the maximum. You can see there are 3 columns, all with different percentages shown. The percentage shown on the benefit sheet is the percentage that Delta will pay when a claim is incurred. As you can see, the percentage is highest when you use a PPO in-network dentist. We encourage you to use a PPO provider as they discount their fees the most. It is slightly lower when you use a Premier dentist. When you stay in network and visit one of these dentists, you won't get charged more than your expected share of the bill. Using a non-Delta dentist or out-of-network dentist may result in balanced billing and higher out-of-pocket expenses. Nitrous oxide and non-IV sedation are also covered on the PPO plan. You can save money with the diagnostic and preventive maximum waiver. Cleanings, x-rays, and exams fall under this category. When receiving those services, they are waived from your annual maximum, saving your benefit dollars. This slide is an example. If you went to the dentist and had an oral exam, x-rays, and cleaning, and the treatment cost was $350. With the diagnostic and preventive maximum waiver, your annual maximum does not go down to $900. It is still $1,250 for the year to be used on other services. Your plan includes the SmileWay Wellness Benefit, which offers enhanced coverage for higher risk enrollees. The health of teeth and gums is tied to overall wellness. Gum disease and tooth decay are associated with a number of systemic conditions, and enrollees with certain medical chronic conditions may benefit from additional teeth and gum cleanings. Delta Dental PPO can take advantage of expanded coverage if they've been diagnosed with the conditions listed on this slide. Members can self-report via their online account, and it's entirely confidential. To summarize, let's take a quick look at the differences between the PPO plan and the DeltaCare DHMO plan. In choosing a dentist, PPO plan, you can visit any licensed dentist, but we do encourage you to use a PPO provider for greater savings. DeltaCare USA plan, you do have to seek services from your primary care dentist. The PPO plan has an annual maximum, where the diagnostic and preventive services do not count towards that maximum. On the DeltaCare USA plan, there is no annual maximum or deductibles. On the PPO plan, covered services are paid at a percentage. Delta pays a percentage of the services, member pays a percentage. On the HMO plan, all of the covered services have preset payments, which are low cost or no cost. On the PPO plan, there is no referral needed to visit a specialist. On the DeltaCare USA plan, you do have to go through your primary care provider to coordinate coverage for a specialist. And for the PPO plan, the dentist will file a claim form for you if they are in network. If they're out of network, you may have to submit the claim. And on the DeltaCare USA HMO plan, there are generally no claim forms to file. We do encourage you to visit your customized website, deltadentalins.com/CCSF, for a myriad of things you can do. Our website has a wealth of information that you can access without logging in. Search for a nearby dentist in your plan's network. Be sure to choose your plan in the drop-down menu, either PPO or DeltaCare USA for the DHMO plan. You can find answers to common questions about dental care and managing costs in our enrollee support guide. Find extensive dental health and wellness information on our website. And you can also sign up for Grin, which is our free dental health magazine that would come to your email inbox quarterly. While you don't need an ID card, if you do want one, you can log in and print your own. As a Delta Dental member, you are eligible for these member perks. Virtual Dentistry, which is a video-based platform that allows you to speak with a dentist live on your phone or device. BrushSmart is a discount program on Philips and Oral-B oral healthcare products. You can also get discounts on hearing aids through Amplifon and LASIK through QualSight. Life Perks, which gives you instant access to offers from a rotating group of merchants. You'll also receive emails that let you know about the newest discounts. And wellness resources, which include online articles, recipes, videos, and more. Scan the QR code for instant access or use the URL listed here. We do invite you to socialize with us on our social media sites where we offer up-to-date dental information and wellness tips.
Welcome. My name is Monica Andrade, and today I will be discussing your dental plan options through United Healthcare. Your employer offers 2 different plans and a range of services from routine checkups, cleanings, to advanced procedures, ensuring you receive the best care possible. With flexible options and affordable rates, maintaining your dental health has never been easier. With the Direct Compensation Dental Plan, you have the freedom to see any dentist in our statewide network without having to choose a primary care dentist in advance. Of course, a primary care dentist can be helpful, guiding in managing your oral health. So you may want to choose one anyway, or see if your regular dentist is in the network and that there is one near you in your preferred area. If you need to see a network specialist, you'll just need a referral from your dentist or contacting United Healthcare Customer Service Department. The plan is designed to fit your life in other ways too. You have no deductibles or annual spending limits, just a fixed copay for covered services and treatments. Coverage for hundreds of different dental services like crowns, braces, and silver fillings. Plus, we also have oral cancer screenings for adults 18 and older, and extra dental visits during pregnancy and the first 3 months after giving birth. Finally, preventative care is most often covered at 100% in the network with a zero copay. The oral cancer screenings just mentioned, for instance, are covered as well as preventative care. Remember that if you decide to see a dentist who's not in our network, it won't be covered by your plan, so it's a good idea to stay in the network. Who's eligible? Employees and retirees, along with their eligible dependents that would include their spouse, domestic partner, and children up to the age of 26. It's easy to let regular dental exams slip through the cracks when life gets busy, but they're crucial for maintaining your overall health. Explore your dental care options to find the best fit for you. Embrace retirement with a confident smile and discover what you've been missing. Prioritize your dental health by learning about your options so you can keep your smile bright and your life healthy. Good oral health may be linked to reducing the costs and complications of many high risk, costly conditions such as diabetes, heart, and kidney disease. Our whole person approach is designed to link medical and dental data to help close gaps in dental care for employees with chronic conditions with the goal of helping improve overall health and lower costs. Gaps in oral care are characterized as a lack of oral health care received within the previous 6 months, as well as the type of oral health care being received. For example, have you been able to get the appropriate periodontal and preventative care for your condition? We can help you identify closing those dental care gaps that may help you achieve better health and save money. Now we would like to discuss condition-specific data. Diabetes. People with diabetes are more likely to have gum disease. If left untreated, this can make it difficult for them to stabilize their blood sugar. However, those who receive gum disease treatment may see a positive impact on their blood sugar levels. Heart health. People with gum disease are nearly twice as likely to have heart disease. Pregnancy. Gum disease in pregnant women may be linked to complications such as preterm birth and low birth weight. Asthma. Employees taking asthma medication may be at risk of cavities, dental erosion, and periodontal diseases. Kidney disease. Treating gum diseases helps reduce inflammation, which can help reduce the risk of kidney failure. COPD. Periodontal disease may increase the risk for respiratory disease. We address individual needs with a whole person approach that includes both preventative and at-risk outreach. 90% of targeted employees were successfully reached by phone and/or mail. Preventative care includes wellness benefits covered at 100% in the network, 2 routine checkups every year, extra cleanings and treatments for expectant mothers, annual oral cancer screenings for covered adults ages 18 and up. We help at-risk employees through enhanced benefits that provide additional preventative and periodontal benefits, including expanded coverage for pregnant employees. Our dental activation combines medical and dental data to help identify at-risk employees and assess whether they're getting dental care to manage their condition. The timely interventions also encourage employees to seek oral health care. Although many services are at no cost to you, there are some services with a copay cost. Please remember to refer to your plan summary for additional information. MyUHC.com helps make it convenient for employees to learn about and maximize their benefits. The updated look and feel to create an experience that is simpler to navigate and understand. Improve usability of content and visuals by focusing on plain language standards and clearly presented information and prioritize actions. We have common navigation, look and feel across all digital assets that includes our websites and our app. With myuhc.com, employees can find a dentist, which makes it easier to locate a network provider who is nearby. You can also get health and wellness information to learn how oral health impacts overall health. Manage your claims. You can view claim history and pay a provider. Look up your benefits. See what's covered by your plan. Easy to access and print your ID cards, which is a convenient way to show proof of coverage. Use a calculator. The cost calculator will help you find what your plan pays for a procedure and what you as the employee will have to pay, and also compare local provider fees. Once you're enrolled, you'll find information and easy to use tools on your member website at myuhc.com and in the United Healthcare app. Together, they make it easier to get the most from your dental plan. You can find a network provider near you to go through your dental plan details, review your claims, and find answers to common dental questions. You can also download and print an ID card. With your United Healthcare plan, keeping up a dental visit is designed to be easier. Simply show your ID card when you visit your dentist. You'll be taking advantage of special network rates. Then, when you're at your visit, you'll only pay the office visit copay along with a specific copay for each covered service. Those copays will depend on your plan design. Finally, once you've had your procedure, you're all done and your claim will be submitted for you. A few points to remember. Our network provides access to board-certified dentists, ensuring top quality care without the hassle of deductibles, annual maximums, or waiting periods. You won't need to fill out claim forms for covered services, making your experience seamless. Enjoy low, predictable dental costs while benefiting from good oral health, which may help reduce the costs and complications of high-risk conditions like diabetes, heart disease, and kidney disease. We address individual needs with a whole person approach, focusing on preventative care and at-risk outreach. Our coverage is network only, ensuring you receive care from the best providers. For additional benefit information, don't forget you can also log into your yuhc.com/SFHSS website. Your 2025 benefit information will be uploaded into the portal for easy access. Additional information found on the website, remember, will be searching for a provider, digital tools to access estimated costs, your health plan ID card, and view balances with claim details. We also have wellness resources that provides free program and activities in physical health, healthy eating, stress management, and flu prevention. Ready to enroll? Review your plan materials and take the opportunity in today's session to ask benefit information that may be helpful in choosing the best option for you and your family. Thank you for allowing United Healthcare to be your trusted healthcare partner.
Hi, I'm Morgan, and I want to thank you for taking the time to learn more about your benefit offering through VSP Vision Care. At VSP, our goal is to help you see well and be well for a lifetime of good vision. Let's take a look at the great vision benefits available to you. How does VSP help you prioritize your health and your budget? First, vision care is essential. Signs of over 270 health conditions can be detected during an eye exam, so it's important it's on your wellness checklist. You get savings that really stack up. Great everyday savings on eye care and eyewear, plus loads of extras so you can save all year long. You can choose high quality care from our huge network of private practice and retail chain locations. Plus, you can shop online on Iconic. Founded by doctors focused on you, your well being is at the core of everything we do. On the last slide, we mentioned that vision care is essential. Why is that? It's the only non invasive way to view your blood vessels. That's how your eye doctor can detect over 270 health conditions during an eye exam. And in some cases, an eye doctor can be the first to detect signs of certain conditions, like diabetes. Even if you don't wear glasses now, your vision can change from year to year. We all deserve healthy eyes. Prioritize you and your family's eye health and wellness, and enroll in vision coverage today. Retinal screening is a quick scan that shows images of the inside of the eye. It can be used to detect eye disease and conditions as a baseline of a healthy eye. Compare year after year to detect even subtle changes. With your VSP coverage, you get a retinal screening each year for a minimal copay, and members with diabetes receive a retinal screening fully covered each year. Your plan already covers the essentials, but if you want even more savings and enhanced coverage options, upgrade your plan during open enrollment. Here's a snapshot of your plan options. With VSP Light Care, it's easy to defend your eyes from the sun's ultraviolet rays or from blue light from screens. And you don't even need a prescription. Simply visit your VSP network doctor and choose ready-made blue light filtering glasses or sunglasses. This is an especially good option for parents with children who don't need corrective lenses. With essential medical eye care, here's what's covered. Fully covered retinal screening for members with diabetes who do not have diabetic eye disease. Exams and services to treat immediate issues like pink eye and sudden changes in vision. Treatment options to monitor ongoing conditions such as dry eye, diabetic eye disease, glaucoma, and more. This coverage is supplementary, and in most cases, your health insurance will be billed first. You may be able to coordinate with your VSP benefits in order to help reduce out-of-pocket costs. If your VSP doctor doesn't participate with your medical insurance plan, VSP has you covered with only the cost of your copay. With VSP, you have access to benefits that you can use at private practice doctors, retail stores, and online. With thousands of locations, getting the most out of your benefits is easy with a Premier Edge provider, including private practice doctors, VisionWorks, and iMart Express retail locations nationwide. Your benefits go further when you visit a Premier Edge location with access to exclusive rebates and offers such as Premier Edge Promise, a worry-free eyewear guarantee, exclusive offers and savings, and advanced exam technology, including digital retinal imaging and more. And if you prefer to shop online, Iconic is the in-network online eyewear store for VSP members. You can choose from over 60 eyewear brands and over 1,600 styles. As a VSP-owned company, Iconic is the only website that seamlessly connects VSP Vision benefits to a member's account. By applying your Vision benefits, you see savings in real time. Save time and money on quality eyewear with a few easy clicks. 1. Connect your Vision insurance. 2. Select your product. 3. Upload your prescription or provide your doctor's contact information, and we'll take care of the rest. We understand that choosing a doctor is a personal decision, so we've made it easy to find the right care for you. Simply navigate to find a doctor on VSP.com. Enter the preferences that are meaningful to you. You can even use the slider to search by distance and view your choice on a map so it's easy to see how quickly you can get to each location. You've seen the everyday savings has built your VSP plan. Now let's take a look at ways you can stack your savings. 50% off additional pairs of glasses and sunglasses at VisionWorks. Prefer to shop online? VSP members save an average of $250 at Iconic, plus free shipping and returns. How about an extra $20 to save on featured frame brands? Plus, VSP members have access to exclusive member extras, like 60% off a pair of hearing aids from True Hearing and so much more. Like vision loss, Hearing loss can have a huge impact on your quality of life. As a VSP member, you have access to savings on hearing aids through VSP's partnership with True Hearing. Visit truehearing.com/VSP to learn more. We also get you're busy, so we put everything you need in one place. Your personalized dashboard on VSP.com. Before your doctor visit, view your benefit and check out special offers. After, you can view your claim and even download your vision savings statement to see how much you saved. You can even take a diabetes risk assessment. And it's easy to toggle back and forth between family members with the Switch Member feature next to your name. Get the coverage you need and save hundreds on glasses, contacts, and more. Vision insurance is worth it. See what it can do for you.
Welcome back, everyone. I'm going to welcome our plan representatives and any SFHSS staff to come on camera and unmute while we open up our Q&A session. And during this portion, I just want to remind our members that you can still be sending questions in through the Q&A function by typing them into the Q&A channel. And you'll look for that Q&A box at the top of the menu or at the bottom of your screen, depending on if you're a mobile device or a desktop. And then please do not share any medical information like your social security or DSW number, as this is a public forum. And we'll be ending the webinar promptly at the top of the hour to allow everyone's time, respecting that time. And then at the 5-minute mark before we end, I'll just be giving a notice as we may not get to all the questions, but we'll try our best. So what I'll do is I'm going to go to the top of the questions that have come in, and I'll be reading them aloud, and then our plan reps or our HSS staff can answer them. I'm just going to refresh to make sure I see them all. And our first question that has come in is, where can I get a list of Delta Care HMO close to themselves in the zip code of 95446? And this is coming from Al. So this is where Delta, this is Delta and HSS staff. Jay can answer that one.
Yeah, Carrie, you can correct me if I'm wrong, but the website to check that list, it's at deltadentals.com/CCSF. And if you have additional questions, you can also call Delta Care USA at 800-422-4234. And if they ask for the group number, it's 71797-0001. And again, I'm dictating this so it can be recorded for this webinar. Thank you.
Okay, thank you.
Thanks, Jay. And Carrie, anything more to add, or did that cover it?
Well, when they do go to the website, the Delta Dental INS website, they'll see a prompt there that says find a dentist. That's the first thing they'll see. And then when they click on that, they'll be able to choose Delta Care USA off of a list of plans. And when they do that, they'll be presented with a screen that allows them to put in what their needs are or their parameters for where they're looking for a dentist and what kind of a dentist they're looking for. And that's where they can make their choice that's how the directory will be pulled up. So just make sure that if you're looking for Delta Care USA, that you're choosing the Delta Care USA plan, because that directory is, of course, unto itself, basically. Has nothing to do with the PPO or anything else. So that's what you want to do. And if you have a hard time using that, then by all means, go ahead and use the customer service number or see if they can't help you find exactly what you want.
That's great. Thanks, Jay, for providing the information in the chat, and Carrie for speaking to a little bit more of the process.
Certainly.
Okay, I'll go back in. It doesn't look like, oh, there we go. Questions have been refreshed. So the next question comes in from M. Can we get access to the replay of this webinar? And that's for our HSS staff to answer. So Jay.
Yes, as soon as this webinar is over, it's going to be recorded, and we'll try our best to upload this by the end of today. But check in tomorrow for sure. We could get it to the same place where you registered for this webinar. It will be on the bottom of that web page. And I'm trying to find the link now, and I'll drop it in here as soon as possible.
Great, Jay, thanks. And that website that's the calendar page, right? So if we go to our HSS web page, it'll direct us to that calendar page for the
Correct.
webinar specifically. Okay.
Yes, but I'll drop in the direct link here.
Great.
I'm almost there. Yep.
Okay, thank you. The next question comes in from Helene. How do you opt into SmileWay? So that may be an HSS or plan specific that can help.
Yes, well, SmileWay is going to be available to you online. You can go to the Delta Dental website and pull up the information on SmileWay, and you will be able to opt in. There is a page where you have to put what your chronic illness is. They'll want to know your doctor's number and name, and then you can just simply opt in from there. If I might add, if you're going to go online and use it for really anything, go ahead and set up an online account, because everything that we're doing now is going into your online account. So anything that, most of the things that you need customer service for, or you need to check on a claim or anything like that, you can do that through your online account, and you'll need a username and a password, but that's always advantageous. And then you'll be able to search the SmileWay information. There's 14 different chronic illnesses that we cover. We give extended coverage to, and those are all listed on the website.
Great, thanks, Carrie. The next question actually is a follow-up. Helene is asking, can you please review the extra services under the SmileWay program?
Okay, well, the extra services, we know that when you have these various chronic illnesses, it does affect your teeth and gums. And so what we do is we extend the benefits to cover additional cleanings. If you just need like routine cleanings, but you just need more of them to keep your oral health. And it also would be covered 100% for you. And in addition to that, if you have any real periodontal problems or gum problems, it will cover additional root planings for you as well that will be covered at 100%. So you just need to get signed into SmileWay and let us know what your chronic illness is, and then we will set you up, and those additional cleanings and root planings will be covered at 100% for you.
Great, thank you, Carrie. Let's see, we're going to refresh our Q&A, see if there's any new questions coming in. Again, the Q&A is the section to be able to write out those questions, and then we'll be speaking them out loud to share it with everyone. And it looks like we haven't gotten a new one in yet. We can just pause for a little bit. I know Jay, oh, was there someone who wanted to share? No? Okay. Jay from HSS is also going to be dropping in just the main webpage to find all of our OE information, where lots of this information is housed. So we can give another minute or two if any questions come in for any of our vendors. Just as a reminder, OE is the deadline is close. We do have some time left, but it's October 24th at 5 p.m. So we want to make sure that everyone is making those selections by the deadline. It is a cutoff to keep us on track. I do see another question that's come through. See, make sure I'm reading it correctly. This is to please provide details for the dental PPO mouth guard benefit. For example, is it every 3 years after the date of the previous mouth guard? And what is the out-of-pocket cost? This is coming from Sophia.
Okay. On the out-of-pocket cost, the mouth guard is covered at 80%. So you would be responsible for 20%. And that can be replaced every 3 years. So, and it's 3 years from when the billing goes through. So if you had, for instance, the impressions done today, the claim would go through with today's date, and it would be 3 years from today's date.
Great. Thank you, Carrie.
Holly, there were 2 questions that you skipped over before. The last one with the previous, the last one about the mouth guard.
Let's see. So I
Helene
we
wanted,
just answered the mouth guard one that was coming in from Sophia. Then we have a new question from Helene. Are extra dentist exams covered under SmileWay?
Well, it's not the exam necessarily that's covered. That would be the initial exam would be done, and then your treatment plan would be established at that point. So they wouldn't do like a recall exam or anything like that. They would be just performing the additional services. So it would be either an additional routine cleaning or prophylaxis, or it would be additional root planings and scalings, but that would be established at your 6-month exam, whether you needed those extras and when to do them in that period of time.
Okay, great. And I am seeing those extra questions that came in. Again, from Helene, can you please explain the number of additional cleanings under SmileWay?
The additional cleanings, I would have to look up the number exactly. That will be listed in the SmileWay information online. Off the top of my head, I'm really sorry, I can't remember exactly how many there are. I thought it was
2
was it
additional.
2 additional? Okay.
So they get 2 with their standard benefit
Right.
and 2 additional cleanings.
2 additional, right. Okay, so that would probably, so you got 4 cleanings a year, 4 routine cleanings a year. Now with the root planing, it will be a little different because root planing is a more serious situation as far as you don't want to do that probably 4 times a year. We usually only do that 1 time a year. So, so the root planings would not be, I'm sure, an additional 2 per year, but an additional 1 per year. So instead of every 12 months, you'll have an additional 1 if you need it.
Thanks, Carrie and Jessica, for answering that one.
Yes.
Al had another question. Do retirees need the same dental plan as their spouse? And that might be an HSS question.
Mhm.
I'll read it again. Do the retirees need the same dental plan as their spouse?
So if you're a retiree, apologize, let me get on camera here. If you're a member and you want to have your spouse on your benefit, then yes, they need to be on the same benefit, the same dental plan that you chose for yourself.
Great. Thanks, Jessica. Jessica, I think I did cover all the ones that were coming in a little bit earlier. I'm going to move up to the front, but let me know if there's more. The next question I see coming is from Irene. Can you be more specific about the root planting under SmileWay?
Oh, the root planing and scaling. Generally, actually, most adults, as they get older, need a more progressive cleaning than just a simple prophylaxis. And that's because of the years of tartar buildup and gum recession and all of that kind of thing. So with the root planing and scaling, what they do is they actually get you numb, and then they go in with their instruments and they go under the gum tissue and really clean that out so that if you have any kind of pocketing or anything, that gives it a chance to heal up. And that's what we're concerned about with these illnesses, is it does cause things like that. They usually do a quarter of the mouth at a time. And because you have to be numb, and so once in a while they might do half of a mouth, but usually they do a quarter of a mouth at a time. And then they follow up with checkups to see how the gums are healing. That's what's involved in a scaling and root planing.
Thanks, Carrie. All right, we'll go to our next question, which is from M. Can members be covered if residing out of the country or if on vacation?
Is that a question for Delta?
It could, Jessica,
Okay.
with HSS, maybe start, and if we need to get specific, yeah.
So Delta Dental PPO is the only plan we have that allows coverage outside of California. I
Mhm.
believe both the Delta Care USA and the UHC DHMO plan are both for in California only.
Well, for Delta, it's on the DHMO, you do have emergency coverage when you're 35 miles away from what your zip code is. That would really mean that anywhere that you were traveling, you're more than 35 miles. If you have a problem, you can get treatment. On the PPO, definitely you can get treatment out of the country, and you have to pay upfront, bring us the receipts, and file them with us, and we will reimburse you according to your plan. The DHMO, however, is just for emergency coverage, whereas on the PPO, you can get full coverage or treatment done. For instance, in Southern California, where I am, the closer you go to the Mexican border, the more you find employees that have doctors in Mexico who want to go across the border and get their treatment done there. And when they're on the PPO, they actually can do that. On the HMO, it's emergency coverage only.
But if the doctor is not in network, they will be paying out of network fees.
That's correct. That's correct. But what they find, a lot of the employees that I have worked with have found is that the fees are so much lower that it makes up for the out of network thing. So when they go down, for instance, to Mexico, they usually go because the fees are still lower than what the allowable amount is, and they don't have to pay as much out of pocket to do that, even though it's out of network.
All right, thank you both. The next question that is a general, I think, retiree question, so it may go to HSS staff. Annabelle is asking, I'm turning 65 years old in January 2026. Do I need to do anything?
So Annabelle, you would need to, if you want to continue your benefit, it looks like you'll be Medicare eligible. For your dental benefit, you do not need to apply for Medicare if you only have dental with HSS, but for your medical benefit, you will need to apply for Medicare. Make sure you have Medicare AB. And you should, I see Elizabeth in the chat has provided you the SFHSS member services contact information to call so you can schedule an appointment and provide the correct paperwork.
Thank you both for the link and for the explanation. The next question comes in from Helene. When I register for SmileWay, does my personal medical information go into a general insurance database available to other insurance entities? What are my privacy protections?
Well, I really don't have a good answer for that because I am not really sure. I do know that I don't think that we share your medical information with anybody other than who needs to have it, which is us. And for our program, we wouldn't need to share it with anybody else. But if you want a concrete answer about that, you may want to call customer service and ask them that question. Generally speaking, we follow HIPAA to the letter of the law, and basically HIPAA says that the information, we only take what we possibly need, what we could possibly need, and we don't spread it around. We just keep it for our own use. And that would be just to make sure that you had eligibility for your SmileWay. But if you absolutely want to check on that, I would recommend calling customer service.
Thank you, Carrie. The next question comes from Irene. Does Night Guard, is Night Guard covered under Delta Dental PPO, and how often?
It's covered under the PPO. It's covered at 80%. And it's covered every 3 years.
80% is for in-network, correct?
Oh yes, in network.
Great, thank you both. And it looks like we don't have any new questions coming in. I'm going to refresh, make sure I'm seeing those ones come in. Unless Jessica, you've seen any.
I don't see any in the.
I don't see any either.
Okay, yeah. Well, as a reminder, we've got lots of information on our website, and our open enrollment period does end on October 25th, or excuse me, October 24th at 5 p.m. Make sure it's clear. Give just a few more
And
seconds.
and Delta Dental did recently provide their one-on-one appointments and consultations. So you can go online. I'm going to share the SFHSS open enrollment website with everyone so that you can access our one-on-one appointments with our vendors.
Thanks, Jessica. I can see that in the Q&A now. And we'll give one last call for any Q&A in our webinar today. Just a few more seconds. If not, then Jessica, I think we've hit our questions, so it's good. Yeah, I don't see any more questions coming in. I'm glad everyone was able to join us today and asking those questions. Thank you to all the vendors and to answering those member questions. We do hope that the webinar was informative and that you'll keep enjoying any webinars during the open enrollment period. So with that, thank you everybody, and just remember to submit all your selections by 5 p.m. on October 24th. Thank you all.
Thank you.
You.
Mm-hmm.
Thank you.